Brain tumors are becoming more common around the world. More and more brain tumors are being reported in all countries every year among people of different ages. Over 700,000 Americans are living with a brain tumor today. More than 84,000 people will be diagnosed with a primary brain tumor in 2021. More than 28,000 kids in the United States are fighting brain tumors right now. This year, approximately 18,000 people will die as a result of a primary malignant brain tumor. A brain tumor is a serious condition. If it is not recognized and treated early, it can be fatal. Hello, and welcome to a new episode of Billion Stories. What is a brain tumor? What are the different types of brain tumors? What are the causes, symptoms, and risks of brain tumors? How is a brain tumor diagnosed? What are the treatments available for brain tumors? In this video, we are going to discuss the basics that everyone should know about brain tumors. To some extent, the disease can be treated and cured depending on the early detection of the disease. So, let's begin. What is a brain tumor? Uncontrolled and abnormal cell growth in the brain is called a brain tumor. This extra growth in our brain puts more stress on the inside of the brain, causing life-threatening complications and brain damage. What are the types of brain tumors? There are two main types of brain tumors, primary and secondary. They are malignant, cancerous tumors and benign tumors. Primary brain tumors or benign tumors are not cancers. They cannot spread to the brain or other parts of the body. At the same time, secondary brain tumors are malignant cancers. It starts in other parts of the body, such as the breasts or lungs, grows uncontrollably, and then spreads through the blood to the brain and other parts of the body. What are the main causes and risks of brain tumors? To determine the exact cause of brain tumors, extensive research is still ongoing. Brain tumors are caused by uncontrolled cell proliferation. This is caused by a change or transformation in our DNA. This mutation affects genes that regulate cell division and kill cells at the right time. This causes the cells to grow uncontrollably. This results in brain tumors. Several risk factors increase the risk of developing brain tumors. The important ones are as follows. Radiation. Radiation can be caused by ionizing radiation such as radiation therapy, X-rays, and CT scans. Moreover, it can come from power lines, nuclear plants, mobile phones, and cell phone towers. Family history. Although rare, some types of brain tumors are genetically inherited. If a lot of people in your family have brain tumors, you are more likely to develop a similar condition. Past cancers. People with childhood cancers, such as leukemia, are more likely to develop brain tumors in adulthood. Adults also have this possibility. However, more research is needed on this. Immunity and drug use. Brain tumors can be caused by immune system disorders or by medication. Diet and smoking. Dietary and nitroso compounds increase the risk of brain tumors in children and adults. Nitroso compounds are formed in the body from nitrites found in certain processed meats, cigarette smoke, and cosmetics. Age and race. As you grow older, you are more likely to develop brain tumors. As such, race is a factor. Caucasians are more likely to have brain tumors than Asians and Africans. Obesity. Obese people are more likely to develop brain tumors. Exposure to chemicals. Exposure to certain harmful chemicals in your life or work environment increases the risk of developing brain tumors. What are the symptoms of a brain tumor? Before we get into that, if you found this video interesting, please consider subscribing to this channel and enable the notification button, and you will be notified of the latest videos. Thanks for subscribing. Then, back to the video. What are the symptoms of a brain tumor? The most common brain tumor symptoms include headache, fits, vision problems, nausea, brain damage due to decreased sensorium, and mood swings. In such cases, the patient experiences unbearable headaches. It comes on intensely in the morning and sometimes subsides with vomiting. But in some cases, you may find it difficult to walk or talk. Not all headaches cause tumors. However, if you see any of the following situations, you need to be extremely careful. If a person who does not have a headache starts getting headaches, it should be taken seriously. The symptoms of a brain tumor may be a gradual increase in the severity of the newly formed headache, or the pain may be felt all day long, and the patient usually wakes up in the morning following a severe headache. When the patient wakes up in the morning, he vomits profusely. But nausea does not occur with vomiting. With vomiting, the headache gets temporary relief. Newly occurring fits. It can be of different types. That is, it can cover only one part of the body or cover the whole body. Weakness or numbness. It gradually increases and covers only one part or one side of the body. Visual problems. Memory problems, behavioral changes, language problems, confusion, etc. When there is difficulty in speaking, sudden disturbances in movement, imbalance, weakness in coordination or facial muscles. If you notice any of these symptoms, seek medical attention immediately. How is a brain tumor diagnosed? If your doctor suspects that you have a brain tumor, they can recommend diagnostic tests to confirm it. They are as follows. Neurological examination. This includes checking your hearing, balance, vision, coordination, reflexes, and strength. Imaging. Imaging tests such as magnetic resonance imaging, MRI, computerized tomography, CT, scan, and positron emission tomography, PET, scan are used to diagnose brain tumors. Biopsy. A small piece of the tumor is surgically removed and examined to determine if it is benign or malignant. Analysis of CSF. Cerebrospinal fluid is a colorless fluid inside the spinal cord and brain. This fluid is tested to diagnose conditions such as brain tumors. Skull X-ray. Brain tumors can cause fractures of the skull. An X-ray will show us this. X-rays can also detect calcium deposits found in certain brain tumors. Angiography. In this procedure, a fluorescent dye is injected into the bloodstream. The dye travels to the brain and allows doctors to see details about the blood supply to the tumor. What are the treatments available for brain tumors? There are various methods available to treat brain tumors. Surgery. This is the most common treatment for malignant brain tumors. The surgeon removes as many cancer cells as possible without damaging the healthy brain cells. Bleeding and infection are two side effects of surgery. Annoying brain tumors can also be surgically removed. Minimally invasive surgery. Neurosurgeons use minimally invasive surgery or minimally invasive techniques to perform this brain tumor surgery to remove cancer cells. This method reduces hospital stay, shortens recovery time, and reduces mortality. Radiation therapy. In brain tumor treatment, X-ray or proton beam-like radiation is used to kill the tumor cells. There the patient sits in front of a machine and wears a protective covering, exposing only the tumor area. Side effects of this therapy include fatigue, memory loss, headache, and scalp irritation. Chemotherapy. In this treatment, the drug is injected or taken orally. The drug then targets the tumor cells and kills them. Chemotherapy can also cause side effects such as hair loss, vomiting, nausea, and fatigue. Radiosurgery. Contrary to the traditional meaning of the word surgery, several beams of radiation are concentrated in the brain tumor to kill the tumor cells. Various techniques such as linear accelerator and gamma knife are used to treat brain tumors with radiation. It is very important to have a lot of positive energy and mental strength when undergoing therapy for such serious illnesses. It will lead to the progress and success of the treatment. I hope you enjoyed this very useful video. Please consider subscribing to Billion Stories and turn on the bell icon so that you will be notified of our new videos. Until we come up with a new video, take care and goodbye.